So my sister is pregnant and she is interested in doing a C-section. She did see online that it is possible to get a tummy tuck after the C-section is done. What are your opinions on that?
So I don't think it's a good idea. I think after, meaning 6 months after, yes, sure. Immediately after is not a good idea. So a lot goes on when you're giving birth, even with a C-section, even though it's controlled.
Mhm.
But the primary focus is to um, get the baby out, healthy, breathing, nice and cute and
Yeah.
juicy and plump, and have mom be nice and healthy, control bleeding. Get when the surgeon does a C-section, the surgeon goes through multiple layers.
Yeah.
So a tummy tuck ends at we're staying above the muscle layer. With a C-section, the surgeon goes through the muscle, through the peritoneal layer, into opens the uterus. There's many more layers involved. Now, there's a lot of drainage, a lot of swelling. The uterus is still very large and swollen. So when we do a tummy tuck, we tighten the overlying muscles. You want everything to be tension free. You want everything to be, nice and clean and blasting through multiple layers with the uterus still swollen, and you're trying to get the most perfect closure and as much skin and excess tissue off is not a great idea. In
Yeah.
fact, you're gonna have a higher risk of complications, higher risk of infection, higher risk of irregularity, still loose skin left
Mhm.
over. I mean, the day after birth, a lot of women are still naturally, normally um, fuller, because the uterus is still large and everything's still blown up, and it takes sometimes months to really get back to, even on the inside,
Yeah.
to normal size. And then you still have some extra weight that you may or may not want to shed. So get the birth over with, focus on your health, the baby's health, and then come back if needed, 6 months to a year later, for a really nice and controlled tummy
I will definitely keep that
tuck.
noted and I will
Yeah,
pass that on to her. Thank you.
wishing the best for her.
Thank you.